Hi, everybody, and welcome back. I'm Darlene Merkler with Inland Caregiver Resource Center, and I am on Facebook Live every Tuesday and Thursday at noon with 15-minute tips for family caregivers. This week, we're going to be talking about older adult sensitivity training. This particular class, when it's given in person, is lots of fun and very interactive. But basically, the idea of it is for us all to try to understand what older adults are experiencing as they get older. I don't think we always think about it, but now that I'm 70, I've been thinking about it a lot, and I have experienced many of the things that we're going to be talking about today. And just understanding what an older adult is experiencing can help us to be more sympathetic. And if we're their caregiver, it can help us understand why perhaps they aren't doing things the way we might think that they should be. So that's what we're going to be talking about today and Thursday. And today I wanted to talk about, in general, some of the things that happen as a normal part of aging. The first thing is hearing loss. And I know we hear that a lot, but I'm going to go into more specifics about that because sometimes we have hearing loss that isn't necessarily helped with a hearing aid. So I want to talk about that today. Also, our speech may change as we get older, our vision, and we may have delayed responses. Even if we don't have a cognitive impairment, we may be slower to respond to things. Learning and memory. Of course, if you're an adult and you've ever gone back to school, you can relate to that. Learning is a lot harder as we get older. And also our memory, even again, if we don't have cognitive impairment, sometimes we forget things and our memory isn't quite as sharp as it used to be. Also, our mobility is affected as we get older due to arthritis and just slowing down in general. Slower metabolism, all kinds of things contribute to our lack of mobility. And so in general, our independence is very affected by the normal aging, just the normal aging process. Of course, we've talked many times on Facebook Live and other workshops that we've given about things that we can do to prevent some of these things, not necessarily the vision and the hearing as much, but the mobility. And of course, diet and exercise has a lot to do with that. So if you were asked the question, if you were given the choice to lose either vision or hearing, which one would you choose? That's a hard choice to make, but most people, when I do this class in person live, choose that they would rather lose hearing than vision. And some people don't agree with that, but I would say the majority of people that I've talked to in workshops that I've given said they would rather lose their hearing than their vision. So I'm going to talk about both today, some of the things that happen that maybe you might not be aware of, but we're going to start with hearing. And hearing loss, of course, a lot of people do have very severe hearing loss and have to get a hearing aid. But there are two types of hearing loss that happen as a normal part of aging that cannot be corrected with a hearing aid. The first one is called presbycusis hearing loss, and that's the loss of the high-pitched sounds. So that would be like S, L, M, T, CH, SH, and TH. So I actually had this happen to me, and I went to had a hearing test, and that's what they told me. The whole top range of hearing was gone, and there's really nothing that can correct that. I realized that it was affecting me because when I was watching TV, I could hear what they were what the person on the TV was saying, but I was missing certain words. And at the time, my ex-husband, he was my husband at the time, kept saying, "You have the TV so loud," but I kept turning it up, not because of the volume that I couldn't hear, but the certain words that I couldn't hear. So your loved one may be experiencing that as well. So vowel sounds are usually heard with this hearing loss, but it is the high pitched letters that I just described to you. S is at the top of that. S's, T's, CH, SH, L's, and M. The second type of hearing loss that cannot be helped with a hearing aid is called conductive loss. And this is when the sound does not get into the inner ear. Oh, it sounds like this. It sounds like that. It's kind of muffled. And I was experiencing this as well. Sometimes when people were talking on TV, they sounded like this. It seemed like they weren't talking clearly. And it just has to do with hearing loss. And so if we can understand that when we're speaking to our loved ones, they may have one or both of these impairments. And again, hearing aid won't help, because if you have a hearing aid on and you're hearing everything except the high pitched sounds, or you're hearing what they're saying but it sounds muffled, a hearing aid's only going to make that louder. So that's really not going to help the person to hear the words more clearly. So those two tests, well, if you go to get a regular hearing test, they will test for those two types. It's presbycusis and conductive hearing loss. And again, those come along as a normal part of aging, and they cannot be helped with a hearing aid. Some tips for communicating with someone who has any type of hearing impairment is to lower your tone. I often say, especially women, what do we do when we see a baby or a puppy or an older person? Hi there, how are you? Our octave goes up about 10 notches and we speak in the highest pitch that we can. It's not about speaking louder to someone with hearing loss, it's about lowering your tone. So many times people with hearing loss will hear a man's voice much clearer than they will a female voice, because our female voices tend to be at a higher pitch naturally. We don't want to shout at the person. Many times I know it's frustrating when you have to keep repeating yourself to someone who has hearing impairment, but if you shout at the person, first of all, it distorts your mouth, and whether people realize it or not, they are reading your lips. They're looking at your mouth to try to figure out what you're saying. So besides, it's just not very nice to shout. So we don't want to shout. We want to be face to face and on eye level with the person we're speaking to. So let's say, for instance, we're talking to someone in a wheelchair. We don't want to stand up and look down at the person. We want to sit in a chair and be on the same eye level. This allows the person to see your whole facial expression, because whether you're an older adult or not, we do depend on each other's facial expressions. We also do tend to read lips. And then we can use a lot of nonverbal communication, like, come on over here, let's go watch TV. Just using your hand to say, come here. If they're not clearly understanding the words, they may understand your gestures. And I think sometimes we make up our own sign language, and it's time to eat. We might use this as a sign to say it's time to eat. Or, are you cold? If you go like this helps the person to understand. So we sort of make up our own sign language as we go along. I know when my grandchildren were babies, my son and his wife were teaching them sign language. So babies did learn this, and then also this for more, and then hungry and eat. And so same kind of principle except for older people. Also, this is directed to the ladies. Men, I don't think you want to try this, but we may want to use a brighter color of lipstick because of the fact that we do read lips. I know that speech therapists, many times, if it's a female speech therapist, they will use this technique so that the person can see your lips much more clearly. We want to speak slowly and distinctly. I tend to talk very fast, and since I've worked with older adults for many, many years, I've learned to speak louder and to slow down. Sometimes I have to catch myself in slowing down and pronouncing my words more distinctly. And of course, we can use an amplification device, a hearing aid, something like that. Also, repeating information. When I talk about Alzheimer's and dementia, I often say if you're going to repeat a sentence to someone with memory loss, you want to make sure that you repeat the sentence exactly the way you said it the first time. Would you like cereal or eggs for breakfast? And if they don't answer in about 30 seconds, which sounds like a short time, but it's really a long time when you're waiting for an answer, you want to say, do you want cereal or eggs for breakfast? Exactly the same way you said it the first time. However, with hearing loss, you want to say the sentence in an entirely different way. And you might have guessed why. Because if they have presbycusis or conductive hearing loss, if you say it in a different way, then you're using different words that may not have as many of the high frequency sounds in them. So, for instance, if you said, would you like cereal or eggs for breakfast? Another way to say that is actually even to show them, I have cereal and I have eggs. Which one would you like? So you're using totally different words, and the different words may not have as many high frequency sounds. Also, if the person is wearing a hearing aid, I know this sounds silly, but this has happened many times when I've been around older adults. First of all, make sure the hearing aid is in their ear, because a lot of people, especially older people that have memory loss, they tend to take their hearing aids out. Make sure the hearing aid is turned on. Make sure that the battery is good in the hearing aid. Those are 3 little simple things that you can check. Be aware of false impressions. So many times older adults will nod their head like they're hearing what you're saying, but they're really not. So sometimes you may want to say to the person, does that make sense? Or can I say or do anything to help make that clearer for you? Just to make sure that they're understanding what you're saying. So I want to finish this conversation on Thursday. I'm going to pick up with vision changes. But right now I'm going to end the presentation, but I just want to remind you of some things at Inland Caregiver Resource Center. We do have one more workshop for this month. We usually do 4 a month, and it's tomorrow, and it's in the evening. It's 6 to 7:30, and the topic is caregiver boundaries. And so that will be from 6 to 7:30. You do need to register for that. So you can call our office, or you can message me here on Facebook, and I can give you instructions on how to register for that. That will be on Zoom. So that's why you have to register, so you can get the information for registering for that particular workshop. I just submitted all of the workshops for August and all of the Facebook Live topics for August. So I'll be posting those probably later this week. I can't believe that next week is actually Saturday. This Saturday is August 1st already. I don't know where July went to, and it had 5 weeks in it too. But I'm so thankful that you all joined me today. I hope that I see you again on Thursday for the second half of adult sensitivity training. You guys have a great day. Bye.